Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please subscribe my channel and also please give your valuable comments. As we know, we were discussing about the history taking, and today we will have another important vital data to be considered, that is occupation of the child. Name, age, sex is over. Now consider consideration of occupation of the patient. Okay, now you can ask, what is the role of occupation when you take the childhood history, isn't it? So, of course, in the newborn, especially, the occupation of the newborn is just born. What about the occupation? Occupation is sleeping, that's all, isn't it? So, in the newborn, the occupation of the parents is very important. So, okay, you have to go with the occupation of the parents. What is the occupation of the mother and what is the occupation of the father? Okay, so that also gives some of the clues about the newborn. Now, if the mother is a working mother and during the pregnancy also she was attending her duties, then we can say the stress factor that she has bared throughout the pregnancy, which may have some of the problems, or she is going to the duties every time she is exposing herself to the external environment, and she may be the victim of some of the torch infections and different other viral infections. So that has to be that means contagious disorders and mechanical disorders, mechanical problems, okay, and the stress that she has taken, and all these things, or over exercise. Exercise is needed during pregnancy, but over exercise is not expected. So therefore, occupation of the parent is very important when you take the newborn history taking. Okay. Now, occupation of the parents also helps to understand the economical status of the family. To some extent it helps, so by which indirectly you can assess the economical status of the family. When we are not able to ask what about your economical status directly, so you can ask the occupation of the parents also. This is this is also quite useful. Now, if the child is, this is about the newborn, if it's a child, a school going child, okay, so what is the occupation then? So usually we say the occupation of the child is it's a student and he is going to the school. Okay, he is in the learning period or the educational period, so he is going to the school, so he is a student is occupation. We can write like a student, because in the school going age, this particular, although you consider studying as occupation, not exactly, but still you can say there are so many school issues. Okay, if the child occupation is school going, then we have to consider some of the school issues: academic stress like conditions, psychological changes, bullying, okay, behavioral changes, okay, antisocial behavior, then the exaggeration of Shayya mutras, or sudden emergence of the secondary type of regressive type of Shayya mutra or nocturnal analysis, then some of the behavioral issues, ADHD like conditions, autism like conditions, learning disabilities. So these are easily identified in the school aging, especially the ADHD, autism and learning disability. This will be actually identified by the teacher. Most of the time the teacher or madam will complain about the child that he is not attentive in the class, he is not sitting in the class, he is not concentrating in the class, he is not able to do the calculations, numbering, etc. So this gives a clue regarding all these aspects. So that's one way how the occupation of the child, if you consider it as a student, it is helpful. Then another is child labor. This is another big issue, social problem now. Child exploitation may be there, child labor will be there. Okay, most of the time, because of the poverty and so many other issues, the children are utilized for different activities. Okay, even the children are utilized in some of the crimes, etc. And this begging, this is a big lobby. Okay, it's a big network. So we'll not discuss that. So such issues will be also there. Okay, so that will be also identified. Okay, and allergic disorders. Okay, occupation, mother and father is having particular occupation, and they are exposed to some of the contagious disorders, and baby is also not baby or child is also getting that contamination. This is one more important which you have to ask about occupation. Then in the adult history taking, if you are coming, we have different issues, isn't it? If the adult, if is a farmer, then allergic disorders are more. If the policeman, then again, or traffic policeman, so varicosity of the veins. If the teacher, dust allergy or vocal cord problems are more. Businessman more suffer the peptic ulcer and disorders related to abnormal lifestyle is there. Gardener, so worm infestations are common, ITBT worker, stress is more, driver, again, he has got different problems. So occupation in adults, we have got a long list or a big list. I will not go in detail, but these are some of the important issues that you have to consider when you take the occupation in the childhood period. Basically, we have to consider the occupation of the parents. Then if you consider occupation as a student life, then some of the issues related to student. If you take the occupation in terms of child labor, so child may be working somewhere else, isn't it? So that is important. Or child may be get exploited. That is important. That you have to take. Okay. So this is all about the occupation of the child in the history taking. Now come to the educational status. Another important vital data is educational status. Again, here the educational status in the pediatric age group, it is the educational status of the parents. Okay, it's not about the educational status of the child, educational status of the parents, that is important, because if the parents are educated, it is very easy to give them the health advice. Okay, so they are aware of their health and they know how to protect their health because they are educated, and by one or the other way they are exposed to this particular awareness, and therefore usually they inculcate these habits in the day-to-day practice, and child is also following the same. That's one thing. And mostly educated parents, we believe that they maintain the hygiene. Not true always. Okay, so most of the time uneducated parents, they are very much hygienic than the educated patients. Okay, educated parents, this is the bitter truth. Okay, and anyway, so we, for all purpose, general purpose, we believe that education gives you more awareness. So it also gives the awareness about the hygiene. Then education and morality. Again, this is also a big question mark. Many times uneducated parents, they give very good moral lesson to the children, although they are uneducated, isn't it? Just like it may not be true always in case of educated parents. Okay, so it is just like you see election, in the election, the educated parents will not vote much because although they are educated, they know everything, they will not cast their vote. Okay, they have got their own issues. But uneducated parents, although they don't know much about the politics and all those things, but they render their duties very promptly, and they are the one who do not miss the election. Okay, anyway, so just for your understanding, I am telling that educated parents may not be so clever always, may not be so aware of the health always, may not inculcate moral values to the children unless and until they are sensitized. Okay, now education status of the child, education status of the parents also helps for the child rearing practices. Okay, so they may not, we believe that they may not involve in some of the wrong child rearing practices like withholding the feeding and not giving the food in the proper time and not giving the adulterated food or external food, etc. So we believe that educated parents will have upper hand on this. Sanitization, the role of sanitization and role of keeping clean, hygiene. So it was better known to the educated parents compared to the non-educated parents. Again, may not be always true. So this is about the educational status. So mentioning of the educational status in the history, vital data, it is very, very important, especially in the childhood practice. Now, another important issues related to this is place. Okay, another vital data which is very important: name, age, sex. Okay, name, age, sex. Then comes the educational status. Then comes the place. Now, place, we have to see that whether the patient is coming from an endemic area or a sporadic area or any epidemic area. So, he is coming from that particular endemic area means he is supposed to bring that from that particular area to another area. Okay, malaria is endemic, Kala-Azar is endemic, okay, and filariasis is endemic nowadays, and that's important. So suppose if he is coming from an epidemic area, so he may spread the disease here also. So therefore that part is very important. Now some of the diseases are very prevalent in some of the areas, some of the countries are prevalent to some of the disorders. We know that Western world is prevalent for some of the disorders, Eastern world is prevalent to some of the disorders. A person traveling from the Western world to India or Eastern world, so he may spread that disease. Okay, that is how these HIV etc. spreaded. Yellow fever, HIV, African fever, etc. has spreaded from the other continent to Indian continent. Okay, Now in the place, one of the important thing is tribal areas. You have to take the history whether this particular place belongs to the tribal area, because we believe that so many congenital hemolytic problems, congenital hemolytic problems in the newborn, so they are more common in the tribal area because of this autosomal recessive and autosomal dominant nature and all those things. Okay, so tribal area, the recessive disorders are more common: sickle cell anemia, thalassemia, then spirocytic anemias, okay, sideroblastic anemias. So it's considered that it is common in the tribal area because usually they will go for inter familial marriages. Okay, so close relatives marriages is very common there, and that's one of the reason. Okay, so tribal area history, whether the place is tribal area, that is very important. Next, small population area, again a group of people residing there, and they don't have much contact with the external world there. So if the people are coming, patient is coming from that area, then we have to think about this type of hereditary problems, related problems. Mountain areas, again, some of the unknown causes of the fevers are common in the from the mountain area, like rickettsial type of fevers. Then coastal area, in the coastal area some of the problems are common, especially hypothyroidism is becoming common because of negative feedback of iodine and all those things. Okay, then snake bite is common in the coastal belt, and some other issues are common in the coastal belt area. So a place, South India, North India, East India and West India. So again, so this is also some of the disorders are prevalent in some of the areas. One more important is migration from one country to another country, place where actually he's staying previously, now where he is. I told so many diseases can be, infectious disease can be brought from the other continent to one particular continent. So what Ayurveda says about this is, Ayurveda basically explains three types of deshas. One is Jangala Desha, Anupa Desha and Sadharana Desha. This is Bhumi Desha. Okay, so Jangala Desha, we know the details about that. Jangala Desha, Anupa Desha, and Jangala Desha is a little dry area and tropical weather and dry areas. Jangala is Jangala, and Anupa means marshy areas where the water accumulation is there, etc. Rivers are flowing, water accumulation is there. Then Sadharana is a combination of the both, and we consider that Sadharana Desha is best one. Now, apart from that, Ayurveda also explains that the place from where the rivers are flowing, the rivers which are flowing towards the western side, rivers which are flowing to the eastern side, southern side, and some of the disorders are very common in that particular area also. Okay. Another important is in Kashyapa Samhita very clearly says in Desha Satma Adhyaya, where he says that the people who are residing in the Purva Deshas, okay, Purva Deshas in the India, in Indian consideration, when we consider the India, the Purva Deshas like the eastern part of the body, eastern part of the country, he says that some of the disorders like Galaganda and then Vigdhridi, Galaganda, Slipada, etc. are very common. And in the Purva Desha, this is common. In the Dakshina Desha, some other Arshas like conditions are common. Like this, he gives different explanation in Desha Satma Adhyaya according to different regions of the India. Then there is also Deshantar Gamana is considered as one of the treatment in case of Amla Pitta. Okay, so Kashyapa very clearly says in case of Amla Pitta, Deshantar Gamana should be done. Change in the place should be done. Okay, so that helps in case of Amla Pitta. So like then again, every time when we consider dosha, dusha, desha, vaya, etc., always desha is considered. Okay, in which desha, geographical area where you are living, that is very important. So therefore, in the history taking, when you ask the place, all these factors has to be considered: endemic area, epidemic area, sporadic area, prevalent disease in that particular area. Okay, tribal area or not, coastal area or not. Okay, so again, Kashyapa says that Kurukshetra area, some 10 yojana, etc. He says that the people who are residing near and around the Kurukshetra area, they are considered very, very strong, and their eating capacity is more, their digestive capacity is more. That's what Kashyapa says. So anyway, therefore the place, this is the importance of place in history taking, especially in the contemporary science and also in the Ayurveda. Thank you very much. So we will meet in another class with another explanation of vital data of history taking. Thank you very much, and please subscribe my channel, and also please give your valuable comments. Thank you very much.